Hello, everybody, and welcome. And today I'm very pleased to introduce Dr. Michael McConnell, who is a preventative cardiologist, which basically means he looks after people with heart conditions and is very proactive in promoting health for the heart. And he's just written a book. Oh, here we go again. Hopefully everyone can see that. Fight heart disease like cancer. That is well sorry. So welcome, Michael.
Thank you. Pleasure to be here.
First of all, would you like to tell us what a preventative cardiologist is?
Sure. I mean, I think the name is fairly straightforward, though I would like many different disease areas to also have a sort of prevention component specialist. But right, a cardiologist are the type of doctors that take care of your heart. And we typically do sort of the diagnosis, medications, and treatments that don't involve going into the operating room. That's a cardiac surgeon. But over the years, many of us have gotten very focused on early detection and prevention of heart disease, particularly heart attacks and strokes, which are sort of the biggest killers for what we broadly call cardiovascular disease. So we look at a range of things, but as we'll get into, some of these are sort of knowing your numbers around your blood pressure, your blood glucose, your blood cholesterol, and then, how do we manage those? And also we have technologies for early detection, and then we have a whole range of treatments that we can use to, as we talk about, sort of stop or reverse heart disease so you never have a heart attack or stroke.
What I liked about your book, which I have to say was, I think I mentioned it, I thought, oh, this is going to be quite dry. But literally, after reading the first paragraph, I was absolutely hooked and fascinated, because we all think, oh, we understand what heart disease is. You have a heart attack. You just need to sort out your motor, so to speak. And it's so not what that's about. So I'd welcome if you could give us a short intro to actually what, heart disease and a heart attack is.
Yeah, great question. I think a lot of the topic of the book is, we have a more modern understanding of how heart disease works. And you're right, the heart itself is that key motor that keeps us going. But a heart attack comes from a problem in the supply to the motor. So we have these very small blood vessels, which we call the coronary arteries. I have a description where Leonardo da Vinci was sort of the first one to actually figure out that when the blood comes out of our heart, these small heart arteries, coronary arteries, make a U-turn, and they have to supply the heart muscle. So, and these heart arteries, they're only about 1/10 of an inch, or only, 2 or 3 millimeters in size. And how heart disease works, in the very first description of it, actually used the word tumor, so they could see growths inside the heart arteries that had a lot of features that we think of. It's not sort of a simple, we use the word plaque these days, which reminds people of plaque buildup on their teeth. But these are growths that are happening inside the heart artery. They have inflammation. They can expand and grow. And the problem is that inflamed tumor, as some people sometimes describe, can be like a pimple that bursts. And what does your body do when there's some damage? It tries to put a blood clot there, but that blood clot may seal up that burst plaque, but in the process, it's blocked the flow in your heart artery. And then your heart muscle dies because it gets no blood flow. And that's what a heart attack is. And if it's bad enough, your heart stops. And that's why we talk about and I talk about in the book, my father-in-law, when my daughters are only 10 and 13, had just given a lecture and was on a bus you know, back to his hotel afterwards. And he didn't get off the bus because, a heart attack had happened, his heart had stopped. And so, we often think that, oh, the first thing that'll happen, I'll get some symptoms, I can get to the hospital. But unfortunately, and one of the big reasons, I have gone into preventive cardiology is a lot of times that first evidence that you have a heart disease problem can be a heart attack or what we call sudden death. So, but you're right, it's these growths of tissue inside our very small heart arteries that then makes it impossible for our heart to beat and stops the motor. So it's really about understanding what are the things that contribute to these plaques or tumors growing, and what are the ways we can detect it early, and then how do we stop or reverse it? What I call, how do we convert these sort of malignant, high-risk plaques and make them benign so that you don't have a heart attack. And stroke is similar to a plaque buildup in an artery going to your brain, can do the same thing. So what we call a brain attack. Yeah.
Yeah, and that's what we'll come on to later, because you go through the things that I was going to say we all know. We do know, because I think where you cross over, you're saying, how we look after people with cancer is very similar how we do with heart. Now, obviously, at Talk Health, we look after people who've got chronic health conditions. And once again, it's absolutely the same and similar advice all the way along. So if you're supporting or trying to manage one condition, you are by default managing every other condition as well that you might have. But I think going back again to sort of the beginning, and I think what I liked about the book is it sort of, I was going to say, it took you on your journey. I mean, it's not, because you're not really talking about yourself, but you do put in that personal thing to understand, you're just not one of those people with a lab coat on who's hidden away and you don't know why you're doing it. You do have a reason behind it. And what was interesting, and I think is how you explain it, is people just think, well, if it's a heart, it's mechanical. And that's how you came up to it to start with, from an engineering type of background or brain.
Yeah, I think that, I think you've captured it well. And I think the whole field of cardiology evolved, over my career, where similarly, starting off as an engineer, it was exciting to work on the heart because it's both a, mechanical, an electrical organ, and has fluid flow. And so all this sort of interesting mathematics, as well as all the technologies that have been developed, bypass surgery and stents. And I got very involved in advanced imaging so we could see inside the heart to see what was going on. But right in the beginning, the whole focus was, do you have a severe narrowing in the heart artery? And does that need a stent or bypass surgery? We now recognize that that's very end stage disease. And that my father-in-law is an example. You can have a heart attack and and sudden death long before you get to where you get a narrowing that you can pick up on a stress test or something like that. So a lot of the focus early on was, can we find these narrowings? And so I had used MRI and other technologies like that to detect that. But we recognize that, if you really want to prevent heart attacks, you have to detect the disease much earlier because it grows inside the blood vessel wall, these plaques or tumors, and your heart can adapt and your blood vessel adapt, so the plaques can keep growing even if the blood flow is good. And if the blood flow is good, you feel fine, until you have that episode where it bursts or cracks and the blood clot. So it has that similarity to cancer that it can grow silently for many years until all of a sudden it presents in a dangerous way. And so we want to be much more what we call upstream, so to speak, of catching the disease earlier, where then we can reverse these growth factors, particularly, getting cholesterol very low, making sure your blood pressure is under control, blood sugar is under control. And then sort of the newest area is developing medications that also reduce inflammation in the body, and because inflammation is a contributor to these plaques growing and becoming more malignant and high risk.
But taking it sort of a step back, which really starts on the management, and I think that's where you can compare it with cancer, which is what your book is trying to say, is that it seems strange that heart disease is far more prevalent than cancer incidence, as I understand it. But we're all aware that from, especially as a woman, as an early age, you start getting tested for you might be tested for the BRCA gene, or you would have your standard ovarian smears and all of those things. But we don't seem to do anything for heart. And as you said in the book, there is a similar, is it a similar gene that we do have? And surely we should be testing for that as early as we're testing for other things.
Yeah, so so one of the sections that I had my daughters who had to grow up with a cardiologist as a father, and as part of it, I've unfortunately passed on a risk gene to them. But one of my daughters, Mia, wrote a piece about how even though she has family history on my wife's side and the gene on my side, um, she got lots of instruction around, self-screening for breast cancer, but no discussion around what she could do for either screening or prevention of heart disease. And the data is, many more women die and suffer from heart disease than breast cancer. So I think that was, I think you caught that part, that there's sort of an awareness of all the screening we need to do for heart disease, for cancer, but not on the heart disease side. Yes, so the gene that I have that I passed on is a risk gene. It's not quite as bad as the other gene that I talk about in the book, which is called familial hypercholesterolemia. That gene, if you have two bad copies of that, you start having heart attacks in your 20s. If you have one bad gene, you can start having heart attacks in your 40s. In Europe, quite a number of countries have put in good screening programs so that children get that checked. And that can give them a normal lifespan. And often what happens if the child is detected, then they look at the parents and they can often catch the parents before they've had a heart attack. It's been in the US guidelines to check, but unfortunately the programs haven't been implemented as thoroughly, and so it's still a relatively low percentage. But right, it's as similarly lethal as a BRCA gene. And so, which is why the pediatric guidelines and the Heart Association guidelines do recommend screening, but not every country has really implemented that well.
If it's the same thing, and I could be completely wrong, I know that in our country, because of the people are very aware of, particularly footballers, of dropping just down suddenly.
Yeah.
That there is, I think, a program that they've started to implement, that if you are a professional standard sports person, you have that screening very early on.
Yes. So, there are a number of conditions that can put athletes at risk. Certainly, the sort of heart disease that I've been talking about in terms of plaque buildup, that can happen early in some people, and there are other conditions related to the heart arteries that can put athletes at risk. So, So right there are screening programs like that. And then I think getting back to so that other similarity between breast cancer and heart disease screening, the main screening test that we use for heart disease actually looks for what we call, small bits of calcium deposits
Mm.
that have formed inside these plaque tumors that are growing. And typically on a mammogram, that's the same thing. A breast cancer tumor can form small bits of calcium, and that's what a mammogram can pick up. So, when I describe to patients, why we'd be recommending what we call a coronary calcium scan, I say it's very similar to a mammogram. It tries to pick up these calcium deposits that develop within these plaques as they grow, because we can detect that much earlier. And that becomes a great time to say, let's, stop the heart disease in its tracks or even potentially reverse it,
Mm.
by getting all your risk factors and growth factors under control.
On the basis that there doesn't appear to be for the, I was going to say for the common man, but everyday people, those tests. So we go back to the preventative side of it, which is obviously what I think that's the middle chunk of your book, is looking at the prevention side, which you've just mentioned. And that's why it's so important that we understand the prevention side. And I know one of the things that I really picked up on with you is know your numbers.
Yeah, so I think, and that's exactly, I think people are thankfully quite aware, and a lot of the European and American heart associations have been very good about promoting healthy physical activity, healthy diet. Um, but I think we're on the heart disease, we've not done as good a job about educating our patients and our primary care doctors even, is really getting to knowing, when I say know your numbers, it's sort of those three big growth factor numbers. So that's know your cholesterol. And it's really knowing what we call your bad cholesterol. The book goes into sort of what are the different numbers and what they mean. Um, Knowing your blood pressure. Actually, in the US, we have an even sort of stricter, lower target for blood pressure than in Europe. And and knowing your blood sugar. We talk about both diabetes, but also prediabetes, which is
Mm.
something that contributes to risk. Um, but the part about sort of what I describe as the first main screening test for heart disease is actually, and every country uses a slightly different score, but there's a website and you put in those things, your age, male, female, do you smoke, do you have diabetes, high blood pressure, things like that. And you get what's your risk over the next 10 years of having a heart attack or stroke? And that's actually the main first step to saying, okay, if I'm low risk, I can keep doing those, healthy activities. But once that risk score goes up, for many people, that's just a good time to get on preventive therapy. I think in some cases we use the calcium score because that's not available for everybody. But right, I think there are many countries that try to have programs to collect everybody's numbers and do their risk score at a certain age so that, they can implement heart disease prevention. But unfortunately, I mean, there was a recent article in the New England Journal here looking at um, how we're doing for heart disease prevention around the world. And uh, in lower and middle income countries around the world, only 1 in 10 people who should be on a heart disease prevention medication to prevent heart attacks and strokes are on it. And even in the US and the UK, it was only about 1 in 3. So that's a lot of why I sort of wrote the book. We've
Mm.
got a lot of science and knowledge. We've got a lot we can do to help know your risk, know your numbers, help prevent heart disease. We've just been very slow to implement it and make it really accessible to everybody.
Mm.
So,
But I
uh,
think that's the problem, isn't it? I mean, for us, those three things that you said, cholesterol, your heart
blood
pressure,
pressure, yeah,
yeah. I
and
mean,
blood sugar, yeah.
getting the blood sugar. I mean, for us in the UK to do, our blood pressure, that's easy because there's some great monitors which are very, most people will be able to afford to buy them. They're not expensive and they're good. But the other stuff, you know, is not as accessible. And if we have to go to a doctor in our country, oh, and I know it's different for us, but it's the same sort of, it's almost impossible to get to see a doctor. And they'd say, well, why would you want to know? It's like, it's almost like you've got to be ill before they will say you could go and have this test. And I think that's the frustrating bit. There's all that information there, but allow us to access it or to be able to do something in an easy way, not because in a reactive way because we're ill.
Yeah, and I think you hinted at that right at the beginning, that a lot of around preventive cardiology is trying to be proactive rather than reactive. And I think this is one of the reasons I wrote the book, directly to people,
Mm.
was I think we're most invested ourselves in being proactive about our health. Um, I think, as many people know, we don't have a huge supply of physicians around the world, and they end up mostly having to focus on reacting to whatever the problem is in front of them that day. And prevention, unfortunately, sometimes takes more time and um, sort of a more comprehensive review of all your data. So it often goes on the back burner, even though you could argue that it's probably the most important thing that we do.
But it's daft, really, isn't it? Because I think when I was saying earlier, if you're looking after your diet, the exercise, and all the stuff that we do know, because we do hear it, if we got that right, we've treated a whole load of conditions as opposed to it's too late. And now we're just, if you're going in because you're being reactive, you're just treating the heart. You're not actually treating the other stuff because it's too late. You
Yeah.
know, you're too far down the line.
Yeah, and I think, and you bring up one of those important similarities where actually cancer can learn from heart disease.
Mm.
Uh, and I put in my book, I was actually surprised when you go to the American Cancer Society website, it lists many of the same risk factors and healthy behaviors that the Heart Association has long
Mm.
promoted. So, we've learned over the years that more regular physical activity, healthy plant-based diets, maintaining your weight, obviously not smoking, limiting your alcohol consumption, all of those help prevent cancer and heart disease. So I do think, to your point, and one of the things that I talk about is the idea we should have more of a broad prevention
Yes.
approach, not, trying to keep track of each thing you need to do for each single disease. There is a lot of commonality, and there's even commonality in some of the screening tests. So the same CAT scan that can screen for lung cancer is what picks up the calcium in your heart arteries. So there is effort to try to combine and screen for these two big killers all together,
Mm.
so we can be earlier and proactive.
Yes, because I was very interested, and I was going to talk about that in a minute about, how you look for one thing, but there are other things you can see, and obviously that's the retinal health. But before we go into that, I know, and what I didn't do at the very beginning, which I normally do, because I just dive straight in because I was so excited about it all and what I now know about heart disease. Um, is your background. I mean, you've got a very illustrious background, from Harvard and Stanford, but also the commercial side of when you've worked for Apple and Google, which sort of going on to the wearables, which I know that you're really interested, the wearables with AI is, in your eyes, is a real positive.
Absolutely. Yeah. And I think, um, I was at a phase of my career where I was working on very expensive MRI scanners to try to see inside your heart arteries, but I was also seeing patients, which I still do in preventive cardiology. And I realized that in talking to patients, where people struggled more was those day-to-day aspects of their health. How do I make sure I get enough physical activity? How do I eat healthy? How can I detect problems early? And I realized working on, many million-dollar MRI scanners was not going to help nearly as many people as if I could figure out how to use the new sort of mobile wearable devices that were coming out. Because, right, almost everybody has a phone with them all the time, interacts with it all the time. And then wearable devices can give you even more information. Um, so, right, we had done a big project with Apple when I was at Stanford where we could have people measure their physical activity, learn their heart score, all through their phone. So, a much more sort of direct to consumer, you could call it, ability to sort of promote heart health. And then when I was working at Google, Fitbit had joined Google. And so we worked on how do we detect an early heart rhythm problem from your wearable device. So I think we're very much at a phase where, particularly and just as I was finishing the book, ChatGPT was coming out. So there's a mention of it, but it's exploded in the year since. But even before that, I had called for the idea that your mobile device has the computational power and the ability to analyze data that you could effectively have a preventive cardiologist in your pocket. So if you have a question, or if it sees changes in your wearable data or in your health record data, it could tell you that there's an increased risk. And how do you, help you get either diagnosed or on appropriate preventive therapy. So yeah, I think we're getting closer and closer, particularly with these new AI tools that are very conversational, that can look at a whole host of data to help us all be proactive. And, I think complements what doctors can do by giving us these tools to help us with prevention and proactive care.
Yeah. I mean, I completely agree with you, but it's educating people to understand where AI fits in health and not trying to say this is a replacement for a doctor. I mean, it is in many ways, but the doctor, we would never want to get rid of that human part of it, because we all know a lot of it is the human interaction with the mental health, which is another underlying factor for everybody's health, isn't it?
Sure, sure.
So
Yeah, I think I think the AI part, what what I talk about in the book is that you sort of want to use AI for what it's really good at, which
the
is
clever bit.
looking at lots and lots of data. Um, particularly as the amount of health data has exploded. It's hard for a human being to be able to sift through, the reams and reams of health data you have. Um, Whereas AI can be very good at that. Um, and particularly for things like medical images or analyzing ECGs, um, that, I mean, it's humans who program the computers, but with that programming, the computers have learned to see things in images or on ECGs, sometimes that even humans can't fully appreciate. Or what I think is most impactful for sort of global health is that the AI can often provide at least an expert level of interpretation of your health data, so that because not everybody in the world is going to have access to a preventive cardiology specialist or a retinal imaging specialist or the most advanced cancer doctor. So the fact that the AI has access to all the data, all the latest guidelines, can try to give everybody access to expert level care, which is, what we all want. So
Absolutely.
it can work with the healthcare system. Yeah.
And it's not going to have an off day where it's suddenly going to forget something. I mean, because there is the trouble with humans is that, you know, we can all make mistakes.
Yeah. I think the other is time, right? I think, unfortunately, over my career, I've also seen the amount of time that doctors have to spend time talking to patients. As much as we want the human element, when there are a lot of people with health conditions and a limited number of physicians, I know my patients complain that they often don't get to ask all the questions that they want and get the full explanation they want because it takes time. And so that's another area where I think combining our human element, but the ability of AI to spend additional time collecting and analyzing data, and then being able and to be able to work in almost any language at any understanding level. Unfortunately, while we now share our clinic notes with our patients, they're still filled with all the acronyms and medical jargon that's hard to understand. So even just using AI as sort of a medical translator,
Mm.
I think has a lot of value in helping people understand what's going on and understand their own health
Yeah.
better.
And I
So
think the last thing, which is what we did touch on, and you touch on it in your book, and that's obviously the thing that's sort of moving along quite quickly, is trying to do to, I was going to say, combine diagnosis. So, for example, when you're looking at somebody's looking at, but I mean, we've done numerous chats where we say the eye is the gateway to health. A bit like your about your teeth and your gums is in many ways the gateway to your health, is understanding that when those are examined, so much more can be discovered.
yeah, so the one of the companies I'm helping now called Toku, Toku, it had come out of New Zealand originally. Uh, we've been looking at using AI to analyze the back of your eye, and actually, which is filled with blood vessels. So it sort of gets back to our
Mm.
initial discussion, which is heart disease or cardiovascular disease starts in our blood vessels. So your back of your eye, it's the one place that a human can directly look and see these, detailed images of your blood vessels. So we've been able to train the computer to see these blood vessels look like someone who's at risk for a heart attack or stroke, whereas these blood vessels look healthy from the back of your eye. It was something that we actually published first at Google, and then this company and a few others have worked to get that into a product. But it's very much sort of what has been the mission of this book in many ways, which is how do we make more people aware that they're at risk so that they can get the appropriate sort of proactive preventive therapy. So, we can, when you get your regular eye exam, we can run an extra 30-second analysis of your retinal image, and that can say you're at increased risk. Let's get you into the system. Let's, check blood pressure, blood sugar, cholesterol, and help manage your risk factors so you don't have a heart attack or stroke. So
And I think it's getting people to, because a lot of people do bury their heads because they feel if they start doing preventative stuff, then there's a chance it might happen to them. It's a bit like writing your will. You don't write your will because if you write your will, you're going to die tomorrow or something silly like that. But that's how we
yeah.
think as humans, isn't it? So
Yeah, and
if
I
it
think,
holds our hands,
I think there's also, I think people like the much more like a concept that, okay, if there's some risk, I could take some medications for a week, but, a lot about managing your risk and preventing heart disease tends to be longer term, more, longer term medicines for your blood
mm,
pressure and cholesterol. I mean, we do have some newer cholesterol medicines that you end up having to only take a shot twice a year. And
wow.
for some people, that can be quite transformative. So I think and I talk about there are people working on, gene therapy. So it could be, one shot for life gives you sort of the opposite of that familial hypercholesterolemia, where for the rest of your life you have low cholesterol, and so your risk of a heart attack is very low. But that's still in the works. But yeah, I think it's human nature. You don't want to think about a long-term problem, and you want a short-term way to fix it. And so, but I try to say that there's a lot we can do to be preventive and proactive, and I think you raised that excellent point. We need to think holistically, right? People don't want to think about 10 different diseases and figure each one
Mm.
out individually. What are things that we can do broadly that help prevent both heart disease and cancer? And so, I think I simplified it to sort of the life's key three, where, uh, be active, get that good cycle of physical activity and sleep every day. Be very thoughtful about what you put in your mouth, from healthy diet to smoking, alcohol, and then get screened when appropriate. And I think that's a big area where heart disease is behind on cancer. So I really want to empower people to understand, know your numbers, know when your risk starts going up, and talk to your doctor about how to prevent. So.
Yeah. Well, thank you very much. And I think you've taken, for me, a lot of the sort of the myth, or I don't know what it is. It's stuff that I don't know. And now I feel it more accessible to understanding and why I would want to be careful with my health. I think that's what came across.
Well, that's great. Yeah, no, it's great to have the conversation, and hopefully more people can learn about their heart and be empowered to help themselves and work with their doctor, and right, get on that prevent, screen, and treat
Absolutely.
paradigm to help stay healthy.
Lovely. Thank you very much for your time, and thank you, everybody.
Take care.